Thousands and thousands and thousands of you in this community have called that phone number. A lot of you saving a ton of money. In fact, the average person is saving over $1,000. In fact, I have sitting right here a whole stack. These are just some of the comments that I've received. It's papers and papers of comments that I've received literally in the last, say, 2 months of the comments that I've received down below from those of you in this community. In fact, I'll pop some of these up throughout this video so you can read some of those comments that those of you in this community have been leaving me after you've called chapter right there to get free help with your Medicare. Absolutely amazing. They've collectively saved those of you in this community multiple millions of dollars, which is absolutely amazing. Anyway, if you're on Medicare, it's your best free resource right there to get help with your Medicare plan. And take advantage of that. Seriously, free. You don't get much free stuff anymore these days. There's a price for everything, right? No. Working with them is totally free, absolutely amazing. Take advantage of that. Oh, by the way, after you do, drop a comment down below. Use the word chapter. That's the keyword that I search for. And let me know how it goes. And I'd love to add your name and your comment to the list of all the comments here and feature you in an upcoming video. All right, anyway, let's pop this article up right here, right now. Feel free to read through the details. In fact, I'm going to be 100% fair with you. I do not have the list of these 15 healthcare systems. I don't have that memorized. I'm being 100% fair with you right now, okay? So I want you to read it for yourself. But there's some big, big, big names on this list here that are eliminating many, many, many different Medicare plans this year, right here, right now. And again, this is going to impact a lot of people, okay? So the point with this is that well, I said this a whole bunch last year, okay? I said this all the time in videos, which is, well, you got to understand, like, hey, is your doctor still within network? Like, what's going on, right? That's why it's so incredibly important to, again, have free resources like chapter right here at your fingertips to basically connect with them and basically see, like, hey, am I still able to see my doctor and all these details like this? But anyway, here's the deal. These 15 different healthcare systems, okay, so I'm hoping that you're reading through the list and seeing if anything is, that you go to is on this list here. But basically what they're doing is they're just continuously dropping all these different plans. And we saw a lot of this announced last year as well. But this is now a more comprehensive list of even more of them that are dropping these right here, right now. Okay, so again, if you're reading through this list of these 15 different healthcare systems, and if you happen to be a patient of any of them, which I would imagine some of us probably are. I know that I'm on the list. I saw a major healthcare provider on the list that I go to, and it's a big deal. It's a big deal, right? So anyway, I think a lot of people are going to be impacted by this in a huge way, and that's very important to understand, right? So the point being with this is that with a lot of these changes that we've seen announced recently, we've continuously seen more and more of these different plans being dropped across the entire country. And then it kind of just like leaves people to scramble, like, what do I do now, right? What do I do if I have this plan, it's being dropped and like I don't have this coverage anymore, right? Like, what do I do? What do I do? Really good question. Well, again, I'm going to say it super fast, which is if you're on Medicare, you're concerned as in your hospital system, your healthcare system was maybe on this list here of the 15 that you saw here on this list, which by the way, this is a list of 15. There were way more than this, okay? There's more than this, but this is just a pretty good list that's dropping many of these plans here right now in 2026. But my point being is that that's the power of having, again, I'm going to say it because it's so incredibly important, and based on all the comments, again, I'll hold it up again, more papers, all of these comments that I've been getting, and the thousands of you in this community that have reached out after connecting with Chapter and talking to them, it's so important to have a resource like that, because if you happen to be one of these people and you're a patient of one of these networks and you go there and realize, the day of your appointment, oh, I'm sorry, we don't take that plan anymore. Really? You don't take this plan anymore? So you mean like my doctor's not covered anymore? Yeah, that's right. Miss Patient, you're not going to be covered. This will have to, if you pay this out of pocket. Nobody wants to get that message, right? And again, very important to understand all this. So, and again, I just wanted to point this out for you really quickly. I wanted to mostly point that article out and just pop that up on the screen for you so you could see it for yourself. And again, I apologize. I don't have that whole list of the 15 memorized, but I really just wanted to put it up on the screen for you so you could see it for yourself. And again, more of the major changes that are coming across on Medicare. And we've seen a lot of this. Over the last year here, we've seen a lot of major changes implemented into Medicare, as in a lot of plans dropped. I talked about this last year as well, a few different times, and said, hey, get ready, get ready. There's going to be a lot of plan changes coming in for 2026, a lot of plans that are being dropped. And here we are.